We're here today to talk about pneumonia in calves and how to control it. I guess really what it comes down to is creating a specific pneumonia vaccination programme for your calves. So it has to be tailor-made for your farm. How we do this comes down to asking the right questions to begin with. The right questions in that, do you have a pneumonia issue? What have you had in previous years? What have you seen? At what age have the calves been affected? How many calves have you had to treat? How many calves have you lost? As well as this, are you happy with the growth rate that you are seeing in your calves? Because it is important to note, yes, growth rate obviously comes down to nutrition, but if we're seeing poor growth rate in the face of good nutrition, it can actually often be down to subclinical pneumonia. MSD has 3 pneumonia vaccines for use in young calves: Bovilis intranasal RSP live, Bovilis bovipast RSP, and Bovilis IBR marker live. Which vaccine you use and when you use them depends on when you see the problems in your calves. So for instance, for the earliest protection against viral pneumonia, Bovilis intranasal RSP live would be the vaccine of choice because you can use it from the day of birth and get protection from it 7 days later. It is an intranasal vaccine, therefore the route is up the nose. If, on the other hand, then you maybe need a little bit more cover, so you need cover against the viral agents, RSV and PI3, but you also need Pastorella cover against Mannheimia hemolytica, well then Bovipast would be the vaccine of choice here. So Bovipast is an inactivated vaccine. Because of this, it means you do need to give 2 doses 4 weeks apart, and that first dose can be given from approximately 2 weeks of age. Now, IBR can also be added to the mix with Bovilis IBR marker live. That can be used in calves from 2 weeks of age. It has to be given up the nose if it's given to calves less than 3 months of age. It has to be given up the nose. The important thing to note here as to whether you would use it or not depends on the IBR status of your herd, and also if the calves are in the same airspace as older animals, because this would leave them particularly vulnerable to picking up IBR. Conveniently, if you are using Bovilis IBR marker live and Bovipast, you can give the 2 together on the same day at different sites, so 1 up the nose, 1 under the skin from 3 weeks of age. Some herds will use one of the vaccines we've mentioned. Some herds will use a combination. The deciding factors actually come down to what they need and when they need them. So irrespective of which vaccine or vaccines we use against pneumonia in calves, what's really important is that we use them correctly. And this starts right from the time they're purchased. So their storage in a fridge that's functional, 2 to 8 degrees. When they're taken out of that fridge, that they're actually used within the correct time frame. If they're vaccines such as Bovilis intranasal RSP live or Bovilis IBR marker live, that they are mixed correctly. And also down to administration. So if a vaccine such as Bovipast, for example, is to be given under the skin, to make sure that it is actually given under the skin. All of these finer details, they're really important. And the thing is, they are actually all written on the data sheet with every vaccine. So it is really worth just having a quick read through to make sure that you're using the vaccines correctly. To get the most out of a calf pneumonia vaccination programme, have a really good discussion with your vet, make a plan, make sure it's practical, make sure it's doable, because this is going to be happening at a really busy time of the year. Make sure it is done well in advance of the calving season so that every calf, from the first calf that hits the ground, can be vaccinated, because this is how we know we can get the most out of a calf vaccination programme.